we're going. Otherwise, I lose everything I wrote. And I got to put this on Facebook. All right. I actually think we are live. I'm pulling it up on my phone so that I can see if questions come up.
Sure.
Whoops. Let's see if we can find this. All right. All right. Welcome, everyone. It's Hemp Your Health, and we have an amazing guest and a great show today for you on how hemp helps with addictions. And we have Dr. Christian Shaw here, who is an MD. He's certified in integrative medicine, addictions, and I was actually going to pull up your bio, addiction medicine, integrative medicine, and a PhD in neurological sciences and science. Um, Dr. Shaw, welcome. Thank you for being here.
Thanks for having me.
It is. I've been looking forward to this because what you are pioneering is huge, and we were just discussing that right now is a traumatic time for some people, most people, and we're going to get to some solutions and suggestions to avoid addictions because they can be sneaky little buggers. And this show is about how hemp helps, and Dr. Shaw is an expert on this. Dr. Shaw, let's dig right in.
Okay.
You have several co-founder and consultant at several medical clinics. How, and you are the founder of RebelMD. So everyone check that out, rebelmd.com. How did RebelMD come about?
Well, RebelMD was really founded as a reactionary movement against conventional allopathic medicine. Specifically, its overuse of pharmaceutical drugs to treat and manage conditions that could more safely and effectively be managed by natural medicinals. And so started with probably the best studied of the cannabinoids at this point, CBD, but there's much more therapeutics down the pipeline that I'm interested in developing.
Ooh, yeah. I think CBD is such a heavy hitter, but I will be excited to hear more about your up and coming research. We'll hopefully have you on quite a few times as our
Yeah, that'd be
expert.
great.
So what was your inspiration to get into cannabinoid medicine?
Well, back in 2013, a patient named Charlotte Fiji, she was not my patient, I was still in training at the time, but she later became very widely known. I think there was a CNN special dedicated to her. She suffered from a rare childhood seizure disorder that's called Dravet syndrome, and she was successfully treated using a specific cannabis strain that contained high concentrations of CBD and low concentrations of THC. This later evolved into what everyone knows now as Charlotte's Web. So she, to me, served as a catalyst for really moving forward and rediscovering investigation of cannabis, the plant, and its derived cannabinoids. And so I think really the success of what happened to her at the time inspired me to kind of perform CBD research.
Were they teaching you about the endocannabinoid system in medical school?
Oh, no, absolutely not. In fact, I would wager that you could run a poll across the country and many doctors would not be familiar with that concept. They might kind of put it together based on just the words themselves, but they would not really understand much about it.
Maybe in your free time, you can pioneer that also.
Sure.
As a physician and neuroscientist, you perform clinical research on treating patients with CBD. What have you discovered so far?
Well, I initially published a case report. The study was started, I believe, God, it's funny. Like one of these guests on these shows we've been together on talked about how this industry is fairly new, but just each year seems like, decades of everything occurring. So believe it was late 2018 when I started this patient study. So she had multiple autoimmune issues. And she had been on long-term kind of suppressive standard treatment that they would use for autoimmune issues such as lupus and rheumatoid arthritis and Raynaud's disease. And it was really at the point where there were too many side effects from the medication she was taking. So she was going to have to move to that next step of biologics. And unfortunately, we see a lot of these commercials for these types of medications, whether it's for rheumatoid arthritis, or psoriatic arthritis. And these are really kind of in my opinion, I'm not a rheumatologist, kind of a last effort, because they're not the coolest things to use. They're pretty rough what they do. So she was open to, before starting this therapy on biologics, to participate in this case study using high dose CBD. And so at the time, there was not much going on. I had to do some pretty serious research on the internet to find GW Pharma, who has come out with Epidiolex. They had some presentations. It wasn't a published paper yet, but I think one of their researchers did a poster presentation at some conference. And so it had some doses of what they used to dose the children with the seizure disorders. And it was quite a substantial amount of CBD. And so I figured, well, I'll base treating this patient on around that high dose. At least there's some precedent, so I'm not a total cowboy doing this. And I started her on a sublingual high dose CBD isolate concentrate, where she was taking 200 milligrams 3 times a day under the tongue.
Wow.
And what was remarkable, so I took blood work before to look at her, with some inflammatory markers. We treated her and took blood again 4 weeks later and showed biochemically that her inflammatory markers went down. And so that was fantastic, because that was in addition to substantiating her, kind of self-improvement from pain scales, quality of life scales, et cetera. And what was most exciting is then over time, I think she continued. So I started to write up that publication. She continued on the 600 milligrams daily for another month. And then we started titrating her down. So then she was at 400 for 2 months, and then she's at 200 for 2 months. And now I believe it's like 100. And what's cool about this is that she's never gone back to any other medication.
Oh,
even to this
gosh.
day. Yeah, it is fantastic. And she was at the point where she had difficulty sometimes getting out of bed, couldn't go to work because she'd be in such pain. She had all kinds of swelling and some of these skin nodules she get on the fingers from some of those, that all disappeared, and it hasn't come back. So that was pretty exciting for my first kind of trial with CBD.
Is it all right if I flash that study on the screen?
Sure. Do you have it?
I have it.
Certainly.
I want to see if I can do a screen share real quick. If not, everyone, actually, let me do this because I haven't actually done a screen share. Well, here it is. So is this the study?
Yep, that is it.
So for everyone listening, this is RebelMD.com, where you can see the case study. That's incredible. And Dr. Shaw, is it common for, if you have one autoimmune disease, to potentially have 2 or 3?
Again, I have to preface that I'm not immunologist or rheumatologist, but just from basic medical knowledge, I would say it's certainly likely, because once you have an inflammatory state in the body, it can just give rise to other inflammatory problems. So if you kind of look at it more abstractly, if your body's in this amped up inflammatory process, depending on the presentation of what becomes affected by that, whether it is joints, whether it is muscle tissue, etc. That's just kind of describing a specific presentation. So for example, someone might just have a dermatitis, which is an inflammation of the skin, but maybe that is just part of an overall inflammatory state. And later on, they get the inflammation of the joint spaces and the joints. So then you're looking more at like arthritis, inflammation of areas of the lungs and the heart, then it would be more of a rheumatoid arthritis. So you see my point. Overall, I think these focuses are so they can try to understand how to treat the disease. But if you look at it more abstractly, I think it's just a whole inflammatory process that I know you've spoken with and understand quite well from your background.
Do you think that CBD works as well as a preventative? If people don't want to wait till they actually get a diagnosis, can we use it as a preventative?
I certainly believe so. I've been taking CBD on a nightly basis for probably 2 years now. And objectively, I have to say, I think that it affects everyone differently. For me, I'm getting older, and I've noticed that the older you get, tend to wake up more times in the night. And I have found I used to wake up 4 times a night. When I started this CBD regimen, before I went to bed, I tend to just be able to wake up once a night instead of 4 or 5 times a night. And what's funny is there's times when I'm traveling, I forget my tincture, and I go back to that waking type of sleep. So I think, and other people have fantastic responses with pain, with inflammation that's related to pain. So I think preventively, it's a great idea.
Oh my gosh. I as a nutritionist, it's hard to sell prevention because people do wait till they get sick to start taking care of their health or get it back. But it's really an important message right now because we talk a lot about stress and how stress can be almost that silent killer because it's such an inflammatory condition. So everyone listening, I hear people say a lot, they don't need CBD because there's nothing wrong with them. Keep it that way. It is so much easier to keep your health than try to get it back.
Absolutely, and I think you'd agree with me from your training. The idea, like years ago, again, it was probably around the time I started hearing about CBD. I started hearing more about vitamin D, and so I started reading the studies on that. I said, this is pretty fantastic, and whether people want to try to critique it at this point and say, well, we've done these large trials and we're not sure that it has all this effect other than what we initially knew it was useful for, it had to do with bone health. Maybe there's some immune properties that are helpful. But we don't know if this is vitamin D specifically or vitamin D is just a marker for something else. I mean, ultimately it doesn't matter because I'm convinced and many others that low vitamin D status leads to a lot of problems. And when you have that status at where it is supposed to be, you have less problems. So back to the preventive discussion, think of vitamin D and think of really the endocannabinoid system, let's just say specifically CBD in this case, as very similar, that you're going to see in the future, I almost assure you, that this is going to be common. Just like 10 years ago, vitamin D was like, what? I'm not sure that we want to take this into conventional medicine. Now, you're seeing doctors order this all the time for their patients. Let's do a vitamin D level. Oh, your vitamin D is low. Now there's studies coming out showing that people with low vitamin D status are at higher risk for more severe complications of COVID infections. So expect to see a very similar thing with endocannabinoids in the future.
I love that prediction, and I support it 200%. Speaking of stress and people looking for ways to deal and cope, is there, in your professional and expertise, a gateway trigger or substance that can contribute or spark addiction?
Yeah, certainly. So I'll just give you a couple that come off the top of my head. And as we discussed before the show, you brought up one, stress. Stress is pretty terrible. Now, I think, well, let me qualify that. Acute stress is very helpful, and there's been all kinds of studies showing that it actually has some performance advantages. It gets you out of situations that are dangerous. It helps you focus when you need to get things done quickly. Chronic low-grade stress, which a lot of Americans have, is a slow ticking time bomb on your overall health. And so I would say that someone that is very stressed comes home for the habitual drink every night, or maybe to have, a joint, whatever way they want to relax using that substance, that is a path that can eventually lead to dependency, which can then eventually lead to addiction. In addition to stress, the two most common that I see from my specialty practice in addiction medicine, people typically have these very serious addictions that come from a history of either sexual or physical abuse. And then the last one that I think is very common is PTSD, which tends to be associated with those two forms of abuses that I'd mentioned, but also if you're in any other kind of extreme situation, typically people think of war as one, So those are very kind of important triggers that you're talking about that can kind of lead down that path to addiction.
Oh my gosh. And I think right now people just need to accept and maybe almost assume that most people are in sort of that spectrum of PTSD. So looking for ways to self-medicate may feel benign, but it could have long-term consequences. And obviously no one wants to end up with an addiction just because it feels good in the moment. So I want to see, I know there are a bunch of parents listening, and I want to address the issue of cannabis from the whole spectrum of the high THC to the low THC, the marijuana to the hemp side. Do you have any advice for parents when it comes to cannabis for kids?
Yeah, I would say first off, be very careful and do a lot of your own research from multiple sources. I was even looking before the show to give more information to the audience that there's been research on the effects of marijuana exposure, and there seems to be kind of conflicting evidence, which in a way is good because it's not definitive yet. So there's probably truth to both sides, but some studies have showed actual cognitive impairments from adolescent heavy marijuana use on a daily basis over years that ultimately resulted in a decline in IQ points, whereas other studies haven't reached that same conclusion. So the other thing for a parent to really consider is the fact that the human brain does not finish developing until the age of 25. And when you're adding something that has that neurochemical influence like THC, you could be disrupting things. So you got to be careful. I would say that CBD itself, probably down the research pipeline later, other cannabinoids, terpene chemistry, I think that stuff is probably quite fine. But unless you can pretty much guarantee that there's virtually no THC in the product, I would not recommend giving it to really anyone under 25.
Thank you, because this is a big deal. We know that, in fact, we just had a comment here that, oh, there's so many coming in. Thank you all for listening. I agree. This is a powerful conversation, and having an expert here is huge. That addiction is a possible trauma response, and kids are absolutely no exception, and they're being traumatized too. So trauma can come in all forms. It can be being addicted to negative thoughts. It can be watching too much news, or there's so much trauma out there right now. So kids, parents, try to keep your kids safe and really offer more activities and exercise, hiking, camping, unplug, because there's so many benefits from just disassociating from the noise out there. And Dr. Shah, I saw on your website that you are doing more case studies and more research. So as a medical doctor, what do you have to share? Everyone's talking about CBD these days. It's new, it's exciting, it's a cure-all. Is there, can you can you kind of take some facts and fiction and share information on all these extremes that we're hearing from your perspective?
Certainly. So I, again, want to go back to my message about being very conscious and doing research on your own to educate yourself. Since CBD and the related cannabinoids are really exploding in popularity, need to appreciate some of these basic concepts, excuse me, that are very important when you're purchasing products. So because this is a new field, because there's a question of how it's going to be regulated, because as you know, there's not much FDA regulation over nutraceuticals, which would include supplements, for example, versus pharmaceuticals. There's not a consistency in quality per se. Unfortunately, the nutraceutical community has established some robust standards so that they've been able to deliver appropriate products that actually have the ingredients in the quantity that's stated on the label. Yeah. Right now, I can't say that that exists for the CBD cannabinoid market. There are certainly reputable companies out there that what you purchase and what it states on the label is in fact what is in that product. But there are unfortunately bad actors in this CBD world right now that are putting out products that have virtually no CBD. They could actually also have some other harmful ingredients, which we can discuss in more detail. But I would say you want to make sure that your product or the company that sells your product has a certificate of analysis associated with that. And what that means is that they've taken their product and they've sent that sample from a product to a lab that they do not have any financial involvement in, so a third-party lab. And that lab does testing to determine, one, what is the concentration, for example, of CBD? Are you gonna get 30 milligrams per every milliliter of your tincture? Is there actually 10 milligrams in each of these gummies? Secondly, are there any harmful toxins that weren't removed during the extraction process, like metals or microbes, for example? Yeah. And that is going to really separate out a lot of the bad actors. Now, unfortunately, part of that is the less expensive the product is up to a point, the chances of you not really getting what is listed there or the quality being poor are very high. So you need to find the companies that sell a product at a reasonable cost and have a high quality that's validated by a certificate of analysis.
I love that. We definitely support those companies and do that ourselves. It's a really necessary practice because just like the supplement industry, I would say over half of the products out there, from CBD to whatever, a multivitamin, do not have what's on the label in the bottle. I've got a question for you from Jim Muller. Does no THC on the label actually mean there is no THC at all? I get this question from family and friends all the time. Thanks.
Sure. So that really depends on the company. So for example, the products that my company and others sell that state 0 THC, it's because there's actually 0 THC in it. And how is that achieved? It's because it's only CBD isolate. Now, the vast majority of the products that you're going to see on the market take advantage of all the inner working cannabinoids. And so they would call that a full spectrum product. Now, based on the Farm Bill, you can produce this from the hemp plant if the THC concentration is below 0.3%. So what that means is essentially if you were out wandering and hiking and you came in some wild hemp plant, that would be kind of a naturally occurring amount of THC, right? It wouldn't, because it wasn't bred to have high THC that the dispensaries use, for example. So that's the standard of using hemp plants to make these extractions that eventually come as these CBD full spectrum products. Now, however, if you're taking that on a daily basis over and over and over, that small amount of THC can accumulate in your system, and that is real THC when a drug test lights up positive for THC. And I think that's an important note because an occupational medicine director, I review drug tests. And unfortunately, I've had to talk to some employees about that when they say, well, all I'm taking is CBD for my pain. I said, I'm happy you're taking CBD for your pain. You're moving in the right direction. That's excellent. Unfortunately, that THC is a very real result. And the only way you can avoid that is either a isolate product, which would be CBD only, or a broad spectrum product where they take the full spectrum and they actually remove all the THC out. If you have either one of those, you should be in good place. And as I advise employees, I would still, when you're using one of these products, either an isolate or a broad spectrum, I would use it for a couple of days and go and, use a home drug test that you buy at, Walgreens or something to test it for yourself first in case. And I think you'll be in good shape.
I love that advice. Home testing is really important. We do not want, and we take very seriously, anyone losing their job over this. And I really feel like we have got a ways to go to actually protect employees so that they're actually not feeling like they're doing anything wrong by taking a full spectrum. However, if you need an isolate, the RebelMD has a really high potency, high quality isolate. And we definitely have some people that are looking for isolate. Our gummies are isolate, but RebelMD has a full tincture of isolate. So check that out. Because until we can deal with, making this plant more understandable in the medical and corporate world, it is something that we all need to be taking very seriously. I've got one more question for you, and then we'll have some closing thoughts. There is a woman, Kim, who also works with people with addictions and helping them get off of the strong pharmaceuticals, asks, have you treated any stroke patients with cognitive impairment with CBD?
No, I have not yet. And I have read when I had to do a presentation, a lot of encouraging research and actual studies involving at least Parkinsonian symptoms and how some of that has improved. So I think if you're suggesting that there's a lot of potential for it, I believe you're right. And I certainly think there is hope. The idea being that the brain is what they call as a plasticity to it, meaning that neurons can kind of regenerate. So it's not once you lose all your neurons, you're hopeless. They can regenerate. And part of that is this process of neuroplasticity. And I believe they're doing research to show that CBD somehow has some influence on that, because CBD is known to have a neuroprotective effect. And they think part of this has to do with stimulating this neuroplasticity, which again comes back to what I would say is kind of this fundamental force of the body that's this pro and anti-inflammatory state, because the more inflammation you have, that tends to cause some of the lack of plasticity in the brain. So maybe it's CBD's anti-inflammatory properties, maybe it's neuroprotective, but yes, I think that it has potential for those kind of cognitive deficits.
This is so cool because neurodegenerative diseases are on the rise also. So again, prevention. I've always been a little terrified of having Alzheimer's because I was not kind to my brain as a youngster under 25, and getting as much health back as possible is really important to me. And I've definitely seen cognitive impairment in myself. I think it will take a lifetime. Luckily, I've got one of those. And so the message is, don't wait till you're sick to start taking CBD. If you have autoimmune conditions, if you're, let's close on this thought. Any suggestion for those people that are listening who are addicted to prescription drugs, the hard street drugs, etc., for using CBD to help with that addictive behavior, withdrawal symptoms, etc.?
Certainly. So I actually discussed a recent case report that I finished. It's going to be published hopefully by the end of this month. I'd like to share it, and maybe we can have another discussion on just how I would recommend CBD for kind of some addiction treatment and emerging research. But I took a patient that was on maintenance replacement therapy for opiate addiction. And at some point, when you are ready to be off that kind of treatment, whether it would be Suboxone or methadone, you titrate off this opiate agonist. And then there's this period of time where anyone that kind of gets off that medication is going to have some challenge, because now they no longer have this opiate replacement, right? The theory being that someone is using heroin on the street, they're coming in now to get treated for this heroin use disorder. So from a medical perspective, you're just replacing an opiate in a safe environment on a daily basis to impart structure. And then they start dealing with all the behavioral health interventions to kind of treat that physical or sexual trauma history. Thereafter, they can start healing their brain, so to speak, from all that, and then get off the medication that really just made it possible for them to be able to participate, because otherwise they're spending their days trying to find more of the drug to use to pretty much nullify the pain and withdrawal symptoms. So I was able to use a high dose CBD regimen on this patient when he wanted to get off methadone detoxification, and it was successful. And I think that's exciting, and I'm moving forward to try some research with other addictions. I can leave the audience with a couple of interesting facts that I discovered when I was doing my literature review for this presentation a week ago. First of all, there was a study that pretty convincingly demonstrated that individuals that wanted to get off nicotine, cigarettes, really, tobacco cigarettes, used a CBD replacement. Instead, there was some kind of a spray, like an inhaler, that they would take as many times as they wanted a day. And they smoked overall many less cigarettes than their counterparts. So don't be surprised if you start to see CBD as a useful kind of nicotine cessation aid as well. I think it's going to be useful for multiple drugs of abuse that I'll hopefully be able to get back and discuss with Christy in the future on the show.
Oh, I would love that. And just not a lot of people consider sugar an addiction. And however, it's very addictive for me. Food has always been my drug of choice. And it does help with sugar addictions too, which maybe seems silly and not so serious, but again, an inflammatory agent. So from nicotine to sugar, sort of like think of them as not as harmful as opiates and heroin and cocaine, et cetera. There's just so much promising research. And Dr. Shah, we will have you on in a heartbeat. You just say when. I'm sure the audience is loving you. There's tons of hearts going off. I really appreciate you being here. Again, everyone, RebelMD, check them out. That case study that I posted online or did a screen share with is on his website. If you have friends, family members, or people that you're concerned about, also reach out to him for help. There's several addiction clinics that he participates in, and he has a very high quality isolate product too for all those that are concerned about the micro amounts of THC. Remember to like us on Instagram, Facebook, and if you want to join our team, please give us a call. We are always looking for advocates in this area of health. Dr. Shah, it is such a pleasure. Thank you so, so much.
Thank you. This was a great show, and I'm excited to come back and try to educate more and share more research in the future.
Thank you. I am very excited about that too. Till then, everyone, mwah, big love, hemp your health, and we'll see you soon, Dr. Shah.
Okay, thanks.
You're welcome. Bye for now.
Bye.